Miss Purple, the right mind for any time. I created this podcast to raise the awareness of mental illness. If you have any of these symptoms, notify your physician or call 911. Another suicide hotline is nationwide is 988. Thank you. The right mind for any time. My name is Deborah Ann Sanders, a.k.a. Mrs. Purple. I have worked 30 years in the mental health field and in various places throughout LA. I started off in nursing as a candy striper, later as an LVN, a 2-year RN, a BSN RN, and 2 years of graduate school. The subject I'm going to try to expound on today is called Street Psych, a Psych Without a Border. My first case is a 30-year-old African-American on the street with a lead pipe, breaking out the windows of people's cars and threatened the neighborhood. 911 was called. Police told the client to put down his weapon. He kept hitting the window with his weapon and kept threatening people. So the officer tasered this 30-year-old male after they was called. He finally took the patient in handcuffs and took him down to the police station. When they tried to take the patient out of the car, he was dead on arrival. One thing about street psych, you had to be very sharp with your assessment. Later on, when they did an autopsy of this person, he had meth in his system. One thing about meth, besides causing bad skin, rotten teeth, psychotic, meth have a habit of putting all your vital signs up, like your blood pressure, your pulse, and your heart rate. When one put a cuff on a meth person, he or she get more agitated, trying to get out the cuff. At that point, the blood pressure probably 210 over 110. If the patient's not put on cold and run to the emergency room, more likely he or she would die of a heart attack or stroke while in the vehicle. My second topic that I'm going to expand on is autism developed delay syndrome. The police was called out because the developing autism client had a fake gun. When they came out to the scene, the gun looked so real. They asked the person to put down the gun. Because he was a danger to the police, he got shot several times and he died on the scene. Whoever came to the scene did not know this person with autism or had mental problems till later on when the family said that patient always had mental illness. One thing about doing street psych, a psych without a boundary, your assessment had to be very, very sharp in the field when you're doing street psych. My last but not least is my homeless diabetic patient. This person is a 40-year-old Hispanic female who had been living on the street for years but doesn't have the means to keep her blood sugar up, or sometimes she rarely take it. 911 was called, the paramedic came on the scene, the police came on the scene. By the time they came to the scene, the woman was in a diabetic coma. Diabetic person tend to also act like a drug addict, and that's what they assume. So when she got to the emergency room, she was in a diabetic coma. The case that I present to you is commonly can occur on the street with street psych. I asked a colleague that does street psych, and I said, if you come across a patient that's very agitated, what is your approach? She said they call 911. The problem is taking 911 with the police come maybe 20 to 30 minutes to the scene. So when you're in the street or you're doing psych without a border, you had to have very good assessment of this patient. You had to have backup support immediately so nobody get hurt or injured at the scene. I would like to give a shout out to LAPD, whom had worked with me in the past, especially the Wilshire Division, Holding Back Police, 1350 1234, FBI. I'd like to give a shout out to the Sheriff Department, especially Cecil Rambo. I also like to give a shout out to anybody that had worked with me in the past and my colleague present. Thank you for listening to my podcast.